that you can have sight today and have none tomorrow? My name is Rutan Ramkelwan, an optometrist attached to the Ministry of Health, Eye and Vision Services. Today, we'll be speaking about glaucoma, a condition that causes irreversible blindness. Now, what is glaucoma, you might be wondering? Glaucoma is an eye condition that damages the eye nerves, and this results in permanent or irreversible blindness. It generally affects persons who are old, but can also affect those under the age of 40. Now, we refer to this condition as a silent thief of sight. Why? Because you can have this eye condition and not even realize until it would have advanced, and then we cannot do anything to save the vision. Though with regular testing, we will be able to diagnose this condition earlier, where we can prevent blindness and even loss of sight. Be on the safe side, get tested as early as possible and encourage your family to do the same. Just remember, the world is bright, save your sight. In the year 2020, it was estimated that there were 7 to 6 million persons diagnosed with glaucoma. And it is estimated that by the year 2040 that 112 persons will be diagnosed with glaucoma. Get tested today. Save your sight. That is very important. Now, who are the persons that are at risk for glaucoma? These include persons who are 40 years and older, who have family members with glaucoma, for those who would have had trauma to the eyes, for those of African, Indian, Asian descent, and for those who may have high eye pressure, and for those with diabetes. If you're in any of these categories with a high risk for glaucoma, you should have your eyes tested regularly. When you're being screened for glaucoma, you will undergo 2 eye routine tests: tonometry and optomoscopy. Now, tonometry is the process of checking the eye pressure. There are many ways to check your eye pressure. The most common method is by an ear puff tonometer, which blows a rapid burst of air onto the front of your eyes. Persons who have a high eye pressure are at a higher risk of developing glaucoma. The second test is called optomoscopy. During this procedure, the eye doctor examines the back of your eye where the optic nerve is located. Eye drops are used to dilate the pupil so the doctor can see through your eye to examine the shape and the color of the optic nerve. This is an important examination to diagnose glaucoma. There are a few other tests that can be done by the eye doctor to further evaluate the eyes for glaucoma. By now, you might be wondering if there is any treatment for this condition. The sad reality is that the damages done by glaucoma is irreversible. But if you're diagnosed in the early stage, then treatment and regular checkup with the eye doctor can help to prevent or slow vision loss. Glaucoma is treated by lowering the eye pressure. There are 3 ways in which the eye doctor may treat your glaucoma: either by prescribing eye drops, laser treatment, and glaucoma surgery, or by combining any of these. Prevention is better than cure. Prevent blindness from glaucoma by getting tested as early as possible.
This week marked Glaucoma Awareness Week. This week has been set aside globally for us to highlight the effects of glaucoma on persons, especially those who are older. Guyana has been marking this day by a number of activities where we are encouraging people to come and get tested so that we can know whether or not you have glaucoma. The Ministry of Health has been promoting a program of not just getting tested to know whether you have glaucoma, but also trying to facilitate the treatment of this disease in our different health facilities. Over the last couple of months, we have been increasing at our clinic the amount of patients that we have been seeing, and we have been working at the Georgetown Hospital to be able to do more cases of glaucoma. However, what we believe is that we need people to come in a timely manner to get checked, and so we can actually prevent this disease by treating it early. or if it's in its later stages, that we can use laser therapy to help to treat these conditions. At Georgetown Hospital, we have returned back to surgery, and persons who would have these conditions are now invited to come back to the clinic so that we can clear up the backlog of cases. We have also restarted services at the National Ophthalmological Hospital at Port Morant. And again, this year we have budgeted about $99 million to be able to upgrade that facility and so that we can treat more cases. So we continue to work on reducing the amount of glaucoma cases in Guyana. And as we do this, we need to reflect and see how we as citizens, what we can do to help to reduce the impact of glaucoma in our country. And if we know a person in our community or a family member who we think might be affected by glaucoma, it is important that we encourage them to come to one of our testing facilities so that we can identify this case and hopefully we'll be able to provide treatment. So as we reflect on Glaucoma Week, there are things that we as an institution at the Ministry of Health can do, but there are many, many things that you as citizens can do. And if we work hand in hand together, we'll be able to reduce the impact of this disease in Guyana.